But today we're going to be talking about flesh-eating bacteria. Now, have you guys heard of flesh-eating bacteria?
Yeah, you talk about it all the time.
I talk about it. Okay, before that, no? All right.
Yeah, I've heard of it in like movies.
Only from
Heard of the
you.
movie. Okay, so it is a real thing. The doctor word for that is necrotizing fasciitis. And I think I had a little graphic. Did you already throw the graphic up?
Gotcha.
Yeah, there it is.
Oh, I thought it was going to be something gross.
No,
there.
that's coming. It's coming. So I'm going to give you warning when that happens. So that's the bacteria there. So flesh-eating bacteria. So
Looks like
this
green
is a
Cheetos.
very...
That's what I see. It do look like green Cheetos.
Cheeto Puffs.
Dude, stuff looks weird under the microscope, man. All right, so this is a very rare but extremely lethal type of infection. And it got a lot of notoriety back in the 1990s because somebody famous died from it. And it was Jim Henson, who, you guys may not know who that is. He was the guy who created the Muppets.
Yeah, yeah.
Wow.
Yeah. Dun, 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 dun. Wait, is that the Muppets?
I don't know. I don't think.
I think that's how that song goes. Anyway, the guy who created the
love
Muppets, Jim Henson,
Okay.
died of necrotizing fasciitis. And so I vaguely remember this from the 90s. There was like a Time magazine article about it. Like, what is this? Do we need to be worried about it? And of course, at the time, I was, like a teenager, so I didn't think anything about it. But then I get into medicine, and then specifically get into surgery, and I kind of learned all about this necrotizing fasciitis. And man, it's like serious business. Now, the lucky thing is, or the good thing, is that it's very rare. It has an incidence of about 1 per 100,000 people per year, which means roughly around 3,000 people in the United States every year get necrotizing fasciitis. That's pretty low, all things considered.
Do you like get it from like being around nasty places or like?
Yeah, sort
Cool.
of. Yeah, we're gonna talk about it. Yeah. But yeah, it's a good question. Like, right, you want to know, how do you get this? Because
Like
you don't want to
like
get it.
jumping in some sketchy looking lake or river or
I
something?
always advise people not to jump into sketchy looking lakes for multiple reasons.
I'm like, so pretty much every lake or body of water in Texas.
Yeah, that's right, man. The lakes here are sketchy. Dude, I grew up on Lake Louisville, man. That place is like,
I
it's
take
sketch.
Avery there all the time.
Dude, you can watch like the fish dissolve before your eyes in the water.
Oh no.
It's pretty bad. I'm just kidding. I grew up on the lake. I grew up there. It's not that bad.
I mean, I go
occasional
there
dead
almost-
body. Huh?
Oh my God.
No, seriously, people
I
die
know.
out there like on the reg.
They tested that lake and found so much of the hormone that girls have when they're on birth control in that water.
How in the world did that get there?
From pee, I
Oh,
guess.
from pee. Oh my God.
Yeah.
See, it's a lake full of pee and dead bodies. Okay, sorry, Lake Louisville. It's my hometown. I feel like I can dog on it.
Yay.
Okay, so this is caused by the bacteria. This shows off to a bad start. No, good start. It's a good start. So this is caused by the bacteria Group A Streptococcus. Now, here's the scary part. This is a common bacteria that everyone has on them right now. It lives in your oral cavity. It lives on your skin.
Yeah, I get strep all the time.
Right.
So does Avery.
Yes, it causes strep. The other things it causes sometimes is cellulitis, which is a soft tissue infection. Most cellulitis are generally caused by Staph aureus, and I know we've talked about that bacteria in the past, but it can cause cellulitis. Now, here's the thing. The Streptococcus bacteria has varying amounts of toxins that it can release. Like some strains of it are very toxic and others are less. And that's one of the reasons that we think that, this bacteria, which is normally, which is all over us, sometimes causes these really severe infections. And what happens is the bacteria gets into a certain location where it's hard for the body to take care of it, and that's along the fascia, the muscles. So fascia is basically it's kind of a fibrous tissue that covers things in our body, like for example, muscle. And it's sort of avascular, meaning there's not a lot of blood flow in it, and blood flow is how our body fights infection. So the necrotizing fasciitis means a death of infection along fascia, okay, if you're gonna break down those words. It can be multibacterial, it can be caused by Staph, Vibrio, and Clostridium. I think a lot of times what happens is when necrotizing fasciitis starts, it just creates a condition where any bacteria can flourish. And so that's why when you culture it late, you're going to see a lot of bacteria. There is a subvariant of this that we are going to talk about because I have the wildest pictures ever that I'm going to show you guys. And it's called Fournier's gangrene. And that's necrotizing fasciitis of the perineum or the crotch.
Cool.
It's specific to the crotch. I don't know why they gave necrotizing fasciitis to the crotch its own name.
Is that what What is gangrene? Because I know
So-
I heard that you hear that all the
Yeah,
time from
gas
like soldiers getting it.
Yeah, so gas gangrene is
back in the day.
basically a condition where you get dead tissue due to injury or infection. Yeah, gangrene. Gangrene just means dead, dead tissue.
Okay.
So, yeah. All right, so how does this thing present, right? Because you don't want to have necrotizing fasciitis, and I will tell you that it is very, very lethal. In the past, I always said that the mortality rate for this was about 50%, meaning, if you get necrotizing fasciitis, it's a coin flip whether you live or die. Now, there's a lot of factors that go into that. For example, if you get necrotizing fasciitis, you're at home and you don't seek treatment, and your death rate is 100%. 100%. You can't survive this without enormous amounts of medical intervention. When I looked at the data, the number I got was like 30% mortality rate, and I think that number is specific to if you get to the hospital with it, what's your mortality rate. So I think the overall mortality rate does really stand around 50% because a lot of people present really late to where there's not that much to do. So because this thing is so lethal, you really want to know if you might have it. Now, not to make hypochondriacs out of all you guys here in the studio and all you people watching, it is really rare, okay? But there are some hallmark symptoms of necrotizing fasciitis that really kind of distinguish it from other infections. And there's two things. One, it is rapidly progressing. This is an infection that you will see a spot that's red, and you come back an hour later and it's this big, and you come back another hour later and it's this big. This stuff progresses like almost to the point that you can visually see it, which is very unusual for infections. Most infections are more slow and insidious. The other thing that really distinguishes necrotizing fasciitis is a term called pain out of proportion, which means that if someone has necrotizing fasciitis and it's just starting, and you go and you touch it, they will scream. It is very, very painful because the infection is along the muscle, versus most soft tissue infections, which are more superficial, they might be sore, but they're not to the point where you would be screaming if somebody touched it. So rapidly progressing, pain out of proportion. The other thing that's really hallmark for necrotizing fasciitis is really unusual appearances of the skin. And I got an awesome picture I'm going to show you guys in a minute, but I'm going to warn everybody before we do that. The other thing that you can get that, no, it's bad. This stuff is like bad.
Is it the crotch one?
I have that one and some other ones, man. Today's show is, I hope we don't get banned because of it. I'm going to put some disclaimers out there. But,
They are some wild photos.
Yeah, don't be cheating now, Trump. Just looking at them ahead of time.
Man.
All right, the other thing that the necrotizing fasciitis causes, and the reason that it causes death, is it causes systemic symptoms, right? So if you get a cellulitis, say on your leg, it'll be red, it'll be sore, but you won't have symptoms elsewhere in general. Necrotizing fasciitis is the complete opposite. What kills you is not the death of the tissue at the location, it's the response that it causes on your body. Those toxins start multiplying as the tissue dies and the bacteria start cranking them out, and suddenly your heart goes into failure, your lungs go into failure, your kidneys go into failure. And how you'd see that manifested early on would be things like extreme fever, tachycardia, confusion. I think we were talking about sepsis the other day. That's sepsis, those are the symptoms. So if any of those symptoms that I talked about, if you have them, seriously seek out medical attention, man. This stuff is no joke and it can kill you. So as far as risk factors, right, because you want to know what puts you at risk, you were talking about jumping into a lake. Realistically, that's not a risk factor for necrotizing fasciitis. Like a risk factor would be a break in your skin. Now, but that thing is that happens all the time.
Yeah.
But a break in the skin does allow the bacteria, streptococcus, which is normally on your skin, to get on the inside.
Yeah.
Our skin is an amazing barrier for infection. It's amazing. But when it breaks down, that's a weak spot for bacteria to get in. And a lot of times you'll just get like a cellulitis or like a run-of-the-mill soft tissue infection, but it can lead to necrotizing fasciitis. The other things that can lead to it are a weak immune system, diabetes, chronic illnesses, alcoholism, and it's actually a lot more prevalent in men for whatever reason. So as I said, the death is caused by sepsis and multi-system organ failure. The other thing is if you survive it, you're left behind with an enormous wound, because the way that you treat this is multifactorial. One, you have to get rid of the area of infection, and that means aggressively debriding, like removing huge amounts of tissue, because the tissue's dying and it's spreading fast, and you got to get ahead of it. And I got a couple pictures that show that. And then it also takes a lot of antibiotics, and that's just to save your life, but then you have to come back and reconstruct whatever hole is left behind from all that cutting. And that's why I have such a lot of experience with this. I did general and trauma surgery for 5 years, And in that time, I saw tons of necrotizing fasciitis because I was the one that was cutting it out. As a plastic surgeon, now I'm the guy that's fixing the wounds. And occasionally I'm the guy that diagnoses it because somebody has something weird and they ask me to see it in the hospital. And I actually, one of the patients or pictures I'm gonna show is a lady, I literally saved her life. Like, I got consulted, they said, this is a really weird wound, can you come check it out? And I looked at it and I put a mark on it and I said, this looks very worrisome. I'm gonna put a mark here, I'm gonna come back in an hour. And when I came back, my mark was here and it was this big. And I was like, that's necrotizing fasciitis. And we took her to the OR and it was, and we saved her life. But yeah, I mean, then we have to go back and fix the wounds.
I've done that before with somebody I knew had MRSA on their leg.
Yeah.
And it was really red.
And you marked it?
And I put a circle around it. I was like,
Dude.
this looks really disgusting.
And
it
then,
looked like a huge, it hadn't broken the skin yet.
yeah.
It was looked like a ginormous like spider bite.
Right. And then did it grow outside of the mark?
Whenever they woke up, it was
That's a
outside of
really
the mark.
smart way, Sarah. That's a really smart thing that you did, and it's a really good thing for people to know that, you know, if you're at home and you have a cellulitis, and maybe it's not like necrotizing fasciitis, right? Because your chances of getting cellulitis is exponentially higher than getting necrotizing fasciitis. But say you have an infection and you want to know is it getting better or getting worse, take a Sharpie pen and mark the edges of it and see if the redness is growing out of it
if it's just
or
like
shrinking.
tender, like abnormally tender.
That's
like
a normal that's cellulitis. Yeah,
Yeah.
pretty standard. Yeah.